understands alternative healing. They're not just going to get a doctor and say, okay, you're on board. They'll have to be a doctor.
So yes, my reply to that is, we do not go out and pick people, we spread the word. This is why I would like everybody, each one of you to just put out this, that there is this team and there is this model. So we just put out the word, and those doctors who are open to working with alternative therapists, they walk in the room. The others don't even come, they don't even want to listen to what we have to say. It works out.
The other thing is, to what you said, is I suggest have a consultant who understands. It's going to be a difficult one to get someone like that who has a little bit of experience of everything, because this is a combination of spirit, mind and body as well as a physical illness that we all manifesting into one. It can't be treated like a hospital. Why do people, us as therapists, have experienced this, that people are emotionally discharged, they go to a psychoanalyst and therapist, and they're very unhappy with the results. They come to people like us who are not trained psychologists, but we're healers. Why? We treat them with more warmth. We give them that due respect as an individual who's going through a difficult time. They don't want to be treated like another normal client or a patient. But they want to be felt that there is a human touch in that dialogue. Most of us have experienced that. So I would suggest have someone on board who understands a little bit of yoga, a little bit, so you know which sphere, as you say, you can't have every client going to each one on the panel. And there might be problems where all 5 people in the team may not be available. So you'll have 2 people judging. And if they're very limited in only their sphere, then who's to judge what treatment or what combination of treatment would this person need?
Yes, I would like to reply to that. So, it is not that only one therapist is available or 2 therapists is available, that the client is going to sit with them and then ask for a diagnosis. So that is not the protocol. It is that all 4 will review, but they are ready with it. If 1, 2 out of station, they got to come back, right? And the environment about it not being like a hospital, that is up to the group how to set up the place. It can be done. It is being done by some people also. So I think all those things can be worked out. Yes.
Having everybody in on the consultation is perhaps an ideal situation.
Could you say that again? I didn't catch it.
Having everybody on the panel in on the opening and closing session is perhaps an ideal situation where everybody is present in the class that you want. Or in an especially difficult situation, somebody is having a problem that nobody can fix. But if everybody in the panel is competent, one shouldn't say any 2 people randomly present may recently show up to fix whatever the problem is.
Yes, they can always try. It may work. It may work many times. So that's what I'm saying. They can try and
the whole thing is we don't need to actually competent. It shouldn't be a question of you try to do it.
See, people have been going over the last so many years. People have been going to people who are very competent and they have not been able to heal them. And so then they go to somebody else. Right? So, here what you're assuming is that one person is so knowledgeable that anybody who comes gets healed. So, why do they need to anybody else to have a look at it?
If I'm wrong, you look for a special kind of person here, somebody who is
what you're saying is, it is good to have an expert that knows 10 different healing systems in a very good depth, right? But it's much better when you have at least these 4 aspects of the human body covered. Now, if these 4 disciplines are covered by one person, they can do it, and there may be people who are working like that already, right? So, yes, the model would work if that one person can keep such a balanced perspective and give a guidance.
But I'm not saying that one person
Yes.
is necessarily going to be the one to say, okay, I'm going to fix it. If that person is got a special
Yes.
For one of his students, but he knows that this person is going to learn something else in life.
Right.
If he says he does not do that person,
Right.
with the expertise.
Correct. So presently, that is what is going on when people come, for diagnosis and healing and treatment. The therapist practitioner does whatever best they can, and when they know certain deeper work is required and a certain thing, and there's an expert, they refer them to that expert. That's what I personally do, right? And even when the premise, of course, getting a premise or a place is very important and the first thing. And we had our team in Bombay. Now there are 15 people come for this meeting, and they say that yes, we need a place and we need a place, but nobody has a place to give at that time. So after 2 meetings and the third meeting, they said, well, we don't have a place, this thing is not working out, and the meeting stopped. Okay, so I had to go and make a visit again to Bombay, call for another meeting, and I said that we have been doing this in the past. I'm not talking about anything new, and that is cross-referencing clients. So let us call ourselves a team that work together over locations. So if somebody comes to you for yoga, and you are doing certain yoga and you're getting some benefits, but it's only working up to a point, and if the yoga therapist themselves says, okay, I think you need to do some kind of clinical testing, or that maybe I will pass you on to my doctor friend, or to somebody else, or different therapist, or psychologist, or something. That's what I explained to the team, that this is how we can work and still keep a team going. So they are now cross-referencing, and the client understands that, that okay, I'm going for this part of this person, then they're referring me to somebody else. On another day, at my convenient time, I get that appointment, and so at least the team works together, and always at the back of the mind, they're looking to get that place. Right? So I would give the mic to Jay for comments and ideas. Okay.
And quick, my only suggestion to this project and this cause is we have a tendency to once we become experts in any field, we have a tendency to assume we know everything. And I'm finding a lot of resistance to allopathy and doctors here. They're not bad people. And let's not throw the baby out with the bathwater. At the end of the day, it's about integrating. And I think the thing to remember through all of this, even for a doctor or for a healer or for a yoga practitioner, is that you don't know it all, and we're all learning. So collaboration is the only suggestion.
Very good.
Thank you, Ajay. Just another comment that was on my mind earlier about this phase of, like Emma mentioned, she started out with yoga. So she started out as an average person, just starting in the healing field, and then over time and therapies, she gained proficiency and built up a practice. So even as healers and therapists, and so many natural therapies, and even about diet and nutrition, what I teach about, I think what we are doing is we are educating and bringing many of these things to the public. So you are going to see now huge amount of population as beginners of yoga, beginners of natural therapy, beginners of people trying out different diet systems, exercise systems. So yes, there's this whole band of people. Frankly, what I do, and from one of my slides where I am talking about 70% of chronic illnesses come from food, and I listed all the illnesses. All that I'm doing there is making people understand which are those foods and how to reverse it. And the average ordinary person is doing it. If you go on my website, you will see some feedback of people, I don't even know them. I read your book, I read this thing about milk, I stopped milk, and in 3 days this is gone. And I've done this, I've done this channel. So you'll see, so what I'm saying is this education, we are in the, our whole movement is about educating the public. And so there will be a range of people who know little, the other ones who are going to know a little more, and we encourage people to understand, practice, all things that are easy and natural. Of course, certain aspects of healing which are mind-based and very psychological, yes, it requires people who have spent many years in that field to give that kind of advice. Yes, sorry, yes.
So, I completely resonate with what Emma said and what Peter said. It's a tall order, but one should keep aspiring to have people who are energy healers but do know about the physical body and the organs in the body, okay, and not just the astral etheric causal body. And we do need people who are working with the mind who, when a prescription is given, like people come, they say, I'm having this drug. So if the therapist has no idea of what goes in the DSM, what does schizophrenia mean, so there is a problem here, okay. So I think education doesn't end with workshop and certification, it is a lifelong process. So we should attract people who are open to learning constantly and upgrading their knowledge. Now, of course, it's a tall order, but one can keep hoping that we'll attract people like that. But I have a logistical question for Darren, which is about the financial implication of something like this, okay? How does it work for the normal person? So, if supposing I say that I'm going to come to your center, okay? And we have a team and people can see me in your center, okay? That's a different kind of, presence that I'm giving for my time. And when people are cross-referencing and they are saying, like you told someone about me, etc. So then they have a choice whether they want to come to me, they want to go to anyone else, then it's different. So financially, how does it work for the normal person? Supposing they want to come to Darrell's center and access this mind which is available for them to get their advice from. Do these people volunteer for a lesser, because it's a non-profit organization to begin with, so do these practitioners volunteer for a lesser rate when they are working with you in your center, which is not cross-referencing, because cross-referencing they have a choice, they can go wherever they want to go. So how is it going to be financially for the common person who's going to come?
I commented on this a little bit yesterday, but I will repeat and give a little more detail. I started off with this scenario that people are already going through. Instead of getting integrated diagnosis within ideally one day, 1 hour spent with 4 therapists could be that short, and then the advice maybe, if not, it may not be on the same day because the therapist will have to meet and spend some time, maybe 15 minutes, half an hour, deciding on a protocol and probably calling the client back the next day, okay, the next day or 2 days after that, we will give you your therapy or treatment protocol. Now, this for me is a very short time span compared to what that person may have gone through over the time period of 3 months, visiting somebody and then going to another place. Because nowadays everybody is, charging as per their time and their effort. So this, if there was no integrated team, the person would spend 500 rupees today, 300, so they are spending that money over a period of time with a lot of wastage of time and trauma, also discomfort. So I see this as something more of a solution and not of a problem. So all that, once the client comes there, I think yes, there should be a small write-up on the modality, or not the specific modalities, but the way we work. And so in that, the client will have to explain this scenario, because it will not hit many people, they're so used to it. If you say, we are going to give you diagnosis, multidisciplinary diagnosis and recommendation within 2-3 days, they'll say, okay, fine, but you're talking about like $1,500 or $2,000. When you explain that this is what you have been trying since the last 5 years, over $25,000, it's not happened as yet, then they get the perspective. Right? So yes, so maybe a half-page write-up on how the system works will really help the client understand what they're going to go through. Otherwise, I know it's going to be a scare for anybody once you tell them, okay, this person is going to charge you 500 300, the other one 500, the other one. So,
Will you come to a common amount after discussing it?
okay, now, yes, now regarding charges, yes, again my request is it's just about 2 or 3 pages in our CMC magazine where this point is also explained, is that how does the center run? Okay, depends on that. Now, if you have got one big sponsor, who's like, there is one, Karupati over here, I went and met him, not because of the Karupati, because I heard that he has got immense knowledge. I'm not going to take his name, because I heard he had immense knowledge on health and healing, and he's been into this since the last 35 years, so I went to his house, and that time he was changing his library, and I could see all the books piled up everywhere, physical, Ayurveda, energy, this, that. So I went to talk to him. Now in case your center gets somebody who really likes this, and they're sponsoring you, then yes, if that sponsor is going to pay all the practitioners, then virtually to the client, the practitioners may be saying, everything we do is free. Now that's the extreme case. Now, so the funds that run a particular center are all depending on the activity of the center. There is no supply of funds from the parent body. So we are more of formulating a model, giving the information, taking back, giving you feedback. Right? So it's more of sharing and knowledge sharing, modality sharing, and creating awareness in public. So it's up to the center, how much they want to charge. There was in Bombay one of the therapists, she was an energy healer, and she said, I do very special kind of work, I have special clients, and I charge 25,000 for a client. And it takes 5, 6, 7, 8 sessions, and it's mutual between me and the client, and the progress of healing. When I talk to them, they're asking for an appointment, after another 15 days, what we have previously decided. She says, first time if I talk to a client and I say, okay, this is what I recommend, now can you get back to me in 15 days? And then she said, when they call back, if I think the person is not yet ready from the talk, I'll ask them to come a week later. So she said, that 25,000, it may be over 3 months or it's over 6 months, but I make the client agree first that this is what it is going to cost. And the payment schedule can happen as and when the therapy happens. And she said, there's no way I can work for your kind of setup, because you're not talking 300, 500, 700, 800. So I said, okay, fine, if that person has chosen that way to work, then they don't work with a setup like this. So team and people are perfectly free to decide what should be. There's one person in our Bombay team who has offered services for free. Says that it's a great cause, and I would come on these and these dates, and everything that I do is going to be free. So that is welcome in any team. So people can work free, they can charge high, and all this will depend on how good they work as a team and their ideas. So, like me doing some of the free programs that engage people, doing some of the programs that are charged. It's all a dynamic that the team can work